One of the most unhinged things I experienced in medicine, either like super toxic or so ego driven, was when I was a pediatric resident in the ICU. And I had a fellow and attendings. So my role was a lot of times just like calling the consults or putting in the orders, right? So we had a patient who had a tracheostomy, so a breathing tube in his neck, and he was a chronic trach patient. So he had it for a long time. And he suddenly started bleeding through it. So me, the resident, was like, that's odd. So I tell my fellow, and it becomes like an emergency tenfold. And the reason is because you can have a tracheoinnominate fistula, so you have an artery that will be connected to the hole in your trachea, and you can bleed out through that hole in the trachea. So it's difficult to control because it's kind of internal, and obviously it's an emergency. Obviously, I'm not as useful as an attending or a fellow in that situation, so I was told to call the cardiothoracic surgeon. So I called the CICU, and I get the secretary. I say, we need the cardiothoracic surgeon ASAP. She said, let me go get him. I'll call you right back. She calls me right back. He says, I don't speak to residents. Mind you, he's at a teaching hospital, but he doesn't speak to residents. We're not that important. Obviously, the attending and the fellow were a little bit busy trying to control this bleeding, but he needed to talk to the attending. So me being the petrified resident that I am, I scurry back and I say, the CT surgeon won't speak to me. I have never seen this attending be angry before, but he was livid. So then he leaves the emergency situation and picks up the phone, calls the secretary because nobody has the cardiothoracic surgeon's number. The secretary then transfers him to the CT surgeon, who then says he'll come by. But like, what an insane thing to say, like, I don't speak to residents. Excuse me, there is an emergency. You are the person we need in said emergency. Just come over and help. Like, absolutely mind-blowing. I hope none of you ever have an ego that big, and that you will respond in an emergency for the benefit of the patient. The goal here is to take care of patients, not your ego.